Good day. I'm Dr. Carl Thornfeldt, and this is my dermatology-trained nurse practitioner, Brittany Irons. I have been a dermatologist for 40 years and have been committed to this community serving dermatology needs for 36 and a half years. I have followed the footsteps of my father, Dr. Bob Thornfeldt, who was a pediatrician and allergist here for 20 years. I want to reassure you that I and my staff will be here to help you navigate your skin abnormalities and skin diseases that may be afflicting you during this time of severe crisis from this deadly virus. Many skin diseases will worsen and many new growths will develop because of the unbalancing of the immune system caused by the severe emotional stress. That then makes you more susceptible to becoming infected with the deadly coronavirus, or if you get it, it will make it more severe. CT Derm will be open during this time to help solve these problems. Unfortunately, we have to minimize the risk by restricting certain aspects of the practice. First, we are reducing the hours to patients and lasers that will be treated between 8 a.m. and 12 p.m. Tuesday through Friday. We want to restrict it to patients who have new onset rashes or an existing rash that has flared significantly or has a new growth. Particularly, we will only do surgery on those that are bad actors, such as probable melanoma and probable squamous cell carcinoma. We have also taken steps to reduce the number of personnel and patients in the waiting room. So we have lengthened appointments to 20 minutes apart. We will only allow the patient and if they need assistance, one other to come in. We will allow you to wait in the car after you check in. We will disinfect all the surfaces, including the chairs and the countertops every hour. We have installed devices that will suck the air out of each of the patient rooms. We have also, the personnel will be wearing masks, and they have also been on antivirals since March 13th to minimize the risk of them becoming infected. So these actions should be really helpful in reducing the volume of patients and personnel in the building at the time. Finally, starting April 8th, we are offering telemedicine services. This is something that is to meet the needs of patients who are afraid to come to the office, yet need to be seen, or are a great distance away and would have difficulty coming in. Most insurances, including Medicare, actually cover these services, but not all the plans do. So it's important that you check with your plan to make sure that it is covered. If it is not covered, we are charging a flat fee of $98 for this 20-minute appointment. During that appointment, 10 minutes of it will be devoted to face-to-face with either myself, Dr. Carl, or with my nurse practitioner, Brittany. So we will be working through these interactive appointments to create the best regimen for you. It may require adjusting of the current regimen that you're on to improve your safety and reduce your risk of developing the coronavirus infection. It may require laboratory tests being ordered, various kinds of imaging tests, possibly changing or adding to other prescription medications, or doing other things that add other aspects of treatment that will allow you to clear as quickly as possible and to be as comfortable as possible. Because when your skin is active, when you are uncomfortable, that creates the unbalancing of the immune system to make you a greater risk. Our goal is to get your immune system as healthy as possible to resist this terrible virus infection. Remember the key symptoms of coronavirus. First is that if you lose taste or smell. Secondly, if you get a stuffy nose that has a green, milky, or yellow discharge, but does not itch. Thirdly is gastrointestinal, like feeling like you're developing the stomach flu. That was the first symptom in the majority of patients in the initial outbreak here in Idaho. And most importantly, if you have a shortness of breath throughout the day, in other words, any kind of difficulty breathing. Now keep in mind, coronavirus does not activate asthma, so this is not an asthma type, this is a difficulty breathing. And then finally, if your temperature is over 100.4. The average incubation period has now been documented to be 20 days. So if you become ill or you suspect that you have any of these symptoms, be sure and self-quarantine for 3 weeks. 2 weeks is not enough. I have been involved with antiviral research for 40 years. And so I have developed a second video where we will get into more detail as far as different physical changes that you can make and different supplements and medications you can take to reduce your risk of infection, or if you are infected, to reduce the severity of the infection. In addition, I will also address the differences between allergic conditions and those induced by the virus. Remember that all of us working together can beat this terrible scourge that's afflicting this nation, but we all have to be in it wholeheartedly. Thank you for taking the time to listen.